Hi, it's Gavin Routledge here. So you're wondering, do I have sciatica? Well, that should be a reasonably easy question for me to ask if you're in the room. However, you're not. So I'll describe to you what sciatica feels like, and hopefully you can deduce from that whether you have sciatica or not. First things first, if your symptoms are really bad, if you're in a lot of pain, or you have any other symptoms such as difficulty with going to the toilet, either urination or defecation, then definitely go and see your doctor. Any numbness, pins and needles in your pelvic floor, that's the area that you'd be sitting on if you were in a saddle. Any problems there, then again definitely go and see your doctor. And if you have a sort of history of cancer and any significant or sudden weight loss, then also go off to see your doctor. So those are the kind of safety things that sometimes do happen in combination with sciatica, but I don't want to worry you. If you don't have those things, no need to worry. So do you have sciatica? So sciatica feels typically like somebody has kicked you in the buttock. So very commonly sciatica presents as a pain deep in the buttock area. Sometimes also in the back of the thigh or the outside of the thigh, the calf area, so the back of the leg or the side of the leg, or in fact anywhere below the knee. So the sciatic nerve is a big nerve, and it serves supplies sensation to the buttock, the back and outside of the thigh, and everything below the knee. So you might have pain, you might have pins and needles, you might have patches of numbness, you may have some weakness, so things like trying to lift your big toe up or push down on the foot. These muscles may be weak. Sciatica doesn't cause pain at the front of the thigh or in the groin area. So if you have pain there and no pain elsewhere, then you almost certainly don't have sciatica. So sciatica would give you pain and or pins and needles, numbness in the buttock, back or side of thigh, and anywhere below the knee. Okay? It's much more common in people who have a history of lower back pain. So if you've had lower back pain on and off in the past, you may very well have developed sciatica subsequent to that. There are other causes or other sort of what we call risk factors for sciatica. So smoking is one, having a high BMI, so being very overweight. There can be work-related factors, postural factors. So if you do a lot of sitting, some studies have shown people who drive more than 2 hours at a time regularly. So if you have a job that involves a lot of driving, that increases the risk of sciatica. Okay, so hopefully from that you worked out whether you have sciatica or not. The bad news is that sciatica can be quite difficult to get rid of. Oh, and while I remember, do have a look at the other blogs on our site. There's one entitled Causes of Sciatica, so have a look at that. Of course there's also there are other videos on sciatica, other things, so do have a look at those. The good news is there's other stuff coming soon. My initiative to try and help 1 million people get a better back, 1millionbetterbacks.com, is on its way. Do have a look at the link at the end of this video. I expect that by sharing with you a lot of information about what causes lower back pain and sciatica, you can help yourself to get better. Okay, so it's not all bad news. Sciatica can be cured. It sometimes takes a little bit longer than we would all like, but I'm sure that working together we can help you to get rid of your sciatic pain. So have a look, feel free to leave some comments, and I hope that we can help you either directly as a real patient or as a virtual patient on our 1millionbetterbacks.com platform. Okay, thanks for listening.